Welcome to Copilot Podcasts. Your therapist just messaged to cancel your appointment, but instead of rescheduling, they sent you a link to chat with their AI assistant. Today, we're diving into the revolution happening in mental health care, where artificial intelligence is transforming how we diagnose, treat, and manage conditions from anxiety to schizophrenia. By the end of this episode, you'll understand how AI is reshaping therapy, what the research actually shows about its effectiveness, and the crucial ethical questions we need to answer. And with us today is an expert in AI and mental health technologies.
Thanks for having me. You know, what's fascinating is that we're seeing AI completely transform how mental health care is delivered. According to recent research from Stanford, AI tools are now being used for everything from early detection to ongoing treatment monitoring.
Wait, so how exactly is AI being used right now in mental health care?
Well, there are several key areas. First, we have AI-powered chatbots and virtual therapists that provide immediate support. Apps like Wysa, which has been clinically validated in peer-reviewed studies, use cognitive behavioral therapy and mindfulness techniques.
Interesting. So these aren't just simple chatbots, right?
Not at all. These are sophisticated systems built from the ground up by psychologists. They can analyze patterns in your responses, track mood changes, and even predict potential mental health crises.
That's pretty impressive. But I have to ask, how effective are they really?
According to a 2025 systematic review in BMC Psychiatry, AI tools have shown significant improvements in user-reported mental health symptoms. They're particularly effective for early detection and intervention.
You know what's kind of ironic? We're using AI to treat conditions that often involve feeling disconnected from human contact.
That's actually a really important point, and it leads to one of the most fascinating developments I've come across, something called AI psychosis.
AI psychosis? What's that?
According to recent reports in Psychology Today, there are cases where people have developed delusions about AI being godlike or even viewing AI chatbots as romantic partners. It's raising serious concerns about how these tools might affect vulnerable individuals.
That's pretty concerning. It reminds me of how meditation apps exploded in popularity, but then we started hearing about negative experiences too.
Exactly. And that's why there's such a focus on ethical considerations now. The American Psychological Association just updated their ethical guidance for AI in July 2025.
What are some of the main ethical concerns?
Privacy is a huge one. These systems are processing incredibly sensitive mental health data. There are also concerns about bias in the AI models and the risk of over-reliance on technology.
But there must be some unique advantages to using AI, right?
Actually, yes. One fascinating aspect is that AI might be better than humans at detecting early warning signs. The systems can analyze patterns across vast amounts of data that human therapists might miss.
That's pretty remarkable. Can you give us an example?
Sure. Recent research shows AI can analyze a person's entire medical record to identify those who might benefit from early intervention, potentially catching signs of depression or anxiety before they become severe.
What about more serious conditions like schizophrenia?
That's where we're seeing some really promising developments. According to recent data, there are about 4 million diagnosed cases of schizophrenia across major markets, and AI tools are helping with both early detection and ongoing management.
How exactly does that work?
The AI systems can monitor changes in speech patterns, behavior, and other indicators that might signal an upcoming episode. This allows for earlier intervention and better outcomes.
That's fascinating. But what about the human element? Can AI really replace human therapists?
That's a crucial question. The consensus among experts is that AI should complement, not replace, human therapists. Therapists bring empathy, intuition, and relational skills that AI simply cannot replicate.
So it's more about augmenting human care than replacing it?
Exactly. Think of it as a powerful tool in the mental health toolkit. It can help with administrative tasks, provide 24/7 support between sessions, and assist with monitoring and early detection.
What about accessibility? I imagine AI could help reach more people?
That's one of the biggest advantages. AI tools can reduce barriers like high costs, long wait times, and provider shortages. They offer immediate, affordable support when people need it most.
But there must be risks to this increased accessibility, right?
Absolutely. A recent Stanford study warned about potential dangers, especially when these tools are used without proper oversight. There's a risk of misdiagnosis or inappropriate treatment recommendations.
How are developers addressing these concerns?
Many are implementing strict ethical guidelines and working closely with mental health professionals. For example, Weisser's AI is built and validated by psychologists, with clear protocols for when to refer users to human professionals.
What about the future? Where do you see this technology heading?
The field is moving towards more personalized interventions. AI can analyze individual patterns and responses to tailor treatment approaches in ways that would be impossible for human therapists alone.
That's incredible. But it also sounds a bit scary, all that personal data being analyzed.
That's why data privacy and security are such crucial concerns. The APA's 2025 ethical guidelines emphasize the importance of transparent data practices and informed consent.
Speaking of transparency, how can users know if an AI mental health tool is legitimate?
Look for tools that have been clinically validated through peer-reviewed studies. Also check if they're transparent about their limitations and have clear protocols for emergency situations.
What about bias? I imagine that's a significant concern.
It's a huge issue. AI systems need to be trained on diverse datasets to avoid perpetuating existing disparities in mental health care. Regular auditing for fairness is essential.
How are companies ensuring their AI tools are culturally sensitive?
Many are now involving diverse stakeholders in the development process and implementing bias detection algorithms, but there's still a lot of work to be done in this area.
Let's talk about cost. How does AI compare to traditional therapy?
Generally, AI-based tools are significantly more affordable. Many apps offer basic services for free or at low cost, making mental health support more accessible to those who couldn't afford traditional therapy.
But I imagine you get what you pay for?
Not necessarily. Some AI tools have shown impressive results in clinical studies. However, they're most effective when used as part of a comprehensive mental health care plan.
What about insurance coverage? Are these tools typically covered?
It varies, but we're seeing more insurance companies starting to cover digital therapeutics and AI-powered mental health tools, especially those that have been clinically validated.
How do mental health professionals feel about these tools?
There's a mix of excitement and caution. Many see the potential for AI to handle routine tasks and provide additional support, but they're also concerned about maintaining quality of care.
What about liability? Who's responsible if an AI tool gives harmful advice?
That's still being worked out. The APA's new guidelines address professional liability, but there's still a need for clearer regulatory frameworks.
It sounds like we're still in the early stages of figuring this all out.
We are, but the potential is enormous. AI could help address the global mental health crisis by making support more accessible and personalized.
What advice would you give to someone considering using an AI mental health tool?
Do your research, look for clinically validated tools, understand their limitations, and ideally discuss it with a mental health professional first.
And what about mental health professionals? Should they be worried about being replaced?
Not at all. AI is a tool to enhance their practice, not replace it. The human connection in therapy remains irreplaceable.
So what's the next big development we should watch for?
Keep an eye on personalized treatment algorithms. The ability to analyze vast amounts of data to predict which treatments will work best for specific individuals could revolutionize mental health care.
That's fascinating. Any final thoughts on the future of AI in mental health?
The key will be finding the right balance, using AI to enhance and expand mental health care while maintaining the human connection that's so crucial to healing.
Well, there you have it. AI is transforming mental health care, but it's not about replacing therapists. It's about expanding access and enhancing treatment. Thanks for joining us on Copilot Podcasts.
And remember, whether you're talking to a human therapist or an AI, the most important thing is taking that first step to get help when you need it.
Exactly. And who knows, maybe next time you're feeling anxious, your therapist will be a caring human supported by some very smart AI.